Hello everyone. 25th of February every year is celebrated as a National Oral Pathologist Day. This date was chosen after the birthday of late Dr. H.M. Dholakia, who was a pioneer oral pathologist from our country. As part of celebrating the Oral Pathologist Day, today we're going to talk to one of the senior most and the most popular oral pathologists in the state of Kerala. He has immensely contributed to the growth of this specialty in dentistry, and he was the former principal of the Government Dental College, Calicut. He was also the former Registrar, Kerala University of Health Sciences, and he is also the recipient of many awards, including the Best Doctor Award and the Best Teacher Award from the state government. With these words, I welcome Dr. Varghese to this program. Welcome, sir.
Thank you, Dr. Shivakumar, for introducing me.
Sir, you have completed more than 40 years as a successful oral pathologist. We are all interested to know more about you, sir, you and your life journey as an oral pathologist. Can you brief us, sir?
Definitely. Like any other dentist in general and oral pathologist in particular, everybody's dream was to become a medical doctor. Mine was also like that. Mine is also like that only. I joined BDS because I got less marks in the competitive examination. But I pursued my journey as a dental surgeon, later took a post-graduation in oral pathology and became an oral pathologist. I started my career as a dentist in the year 1973 in the Government Dental College, Trivandrum, and later I took post-graduation in oral pathology and microbiology in the year 1986. I pursued my career as an academician, teaching many students in Trivandrum and Calicut Government Dental Colleges, and became the principal of the Government Dental College, Calicut.
So during your tenure as a principal in the Government Dental College, Calicut, what were your contributions as an oral pathologist?
Well, Dr. Shivakumar, my contribution to the oral pathology in the state of Kerala, at present there were two dental colleges, one Calicut and Trivandrum. In both the dental colleges, I was instrumental for starting PV course. One in Calicut, Trivandrum in the year 84 and 1998 in Calicut.
Sir, to become an oral pathologist, I think you have to be a dentist first. Was this your choice or your destiny, sir?
Definitely, it was my destiny. After completing my BDS course from the Government Dental College, Trivandrum, I appeared for a PSI interview in the state of Kerala, and I got first rank in oral pathology and microbiology and joined as a tutor in the Government Dental College, Trivandrum. Later, I pursued my post-graduation and became an oral pathologist under the guidance of many of my senior teachers.
Sir, you are an inspiration to many, including me. Is there somebody who has inspired your life too, sir?
Definitely, in the success of everybody, there is somebody who are there to motivate them. Dr. Jacob Zakaria, the pioneer oral pathologist in the state of Kerala, has inspired me like anything. Not only Dr. Jacob Zakaria, other famous oral pathologists in the country like Dr. Vishwadhadan, Dr. A.P. Bhatt, they have inspired me a lot. Coming to my teachers, Dr. C.K. Sugadan, Dr. Sarama Matthew, and Dr. Ram Manohar really inspired me to become a good academician as well as a good clinician.
Sir, you have been teaching for many years and you are considered as a very student-friendly teacher. What is your opinion on the present-day teaching and the student-teacher relationships?
Really, an academician should be student-friendly. As an academician, to be successful, you have to win over the confidence of the students, which is lacking in the present-day academicians.
Sir, you must be having a lot of experiences with the student as a teacher. Can you share for the viewers any one such incidents with the students?
Definitely. During my tenure as principal of the Government Dental College, Calicut, one 5-year student is failing for 3 to 4 times. In a government college, It is very rare. A student may fail for one time, next time they will definitely pass. I call the student and find out he has got plenty of family problems. His father, who is a very big official, wants him to become a medical doctor. Moreover, his sister is also a medical doctor. So he has been tortured by the parents. Later I called him, I convinced him the importance of dentistry in general and become a professional in particular. And he could achieve to get a pass during his BDS. During his house residency, I told him to take a room in the nearby hotel and to study for the entrance exam. You were surprised that he got entrance examination for MDS in the first attempt, and he took oral pathology MDS, and now he is a one senior professor in a private medical college in the state of Kerala. See, if you motivate a student, definitely you will be remembered by those students and their parents also.
Sir, we all know that oral pathologists are good academicians. What is your view as oral pathologists in clinical practicing, sir?
In India, from the inception of oral pathology as a specialty of dentistry, clinical practice is started till 2006. After 2006 to 2012, there is a mushrooming in the dental college and everybody was opted for academics. Nobody was pursuing the clinical practice. Now academics is saturated. Now the only option is the clinical practice. Being an oral pathologist, we are the most efficient clinicians who knows the pathogenesis of any disease. We know the structure of any tooth. We know the structure of the oral mucous membrane. So as a practitioner, we are the most successful people among the various dental specialties.
So we all know that oral pathologists are good researchers as well. What is your view on this oral pathologists taking up a research as a profession?
Really, it is a very pertinent question. To my experience and knowledge, there is no researchers in oral pathology in our country. Everybody is taking PhD and other degrees, but no real researchers. In India, they have got ample opportunity for the research. While during the PD program, that is masters, they have to write the examination called JRF examination by Government of India. It is called a Junior Research Fellowship. Once they pass this thing, they can proceed for any research in any very good institutions in India, like Indian Institute of Science, Tata Memorial Institute, like that. Once you get a PhD, there is another examination called SRF, Senior Research Fellowship. Once they pursue or pass this examination, they can do postdoctoral and they can achieve many things. Moreover, in the foreign countries, there are ample opportunities for research in oral pathology and basic sciences. If you pursue there, you can do doctoral and postdoctoral and you can achieve a very good oral pathologist as an academician.
So for any specialty, the association has a major role to play. What is your contribution towards the association, the Indian Association of Oral and Maxillofacial Pathology or the state level of Oral and Maxillofacial Pathology? What is your contribution, sir? Can you brief us?
I was a member of the Indian Association of Oral Pathologists and Microbiologists from the inception of the association. Later I became the executive member and the president of the association. I organized 2 conferences, one in Calicut and one in Rwanda. I was an active member of the Indian Association of Oral Pathologists and Microbiologists from the inception of the association, and I could become the president of the association. Later, I, with the help of my friends in Kerala, organized a Kerala chapter of the association.
Sir, before we wind up, Do you have some advices for the young oral pathologists in our country, sir?
Yes, the oral pathologists are the best clinicians because of the topics we are studying. I should say that many of my colleagues, my students, and myself, we were very good practitioners and we are successful practitioners. I know many of the teachers who are working in different colleges in the state of Kerala, they left the teaching profession and continued the practice. Definitely, practice is the most suitable avenue for the oral pathologist. And I request all the present day oral pathologists to pursue, study their career to become a good clinician and be successful in their life.
Thank you very much, Aib sir, for your valuable time. And it was a great experience for me and a memorable one throughout this chattings. Thank you very much.
Thank you very much,
Thank you.
Dr. Sivakumar.
Thank you.